solutions to tackle challenges faced by the Ghanaian health sector in areas of strategic priority. He previously served as the Director of Family Health Division of the Ghana Health Service. Dr. Kumar Abuaje is a Senior Public Health Physician Specialist and a Fellow of the Royal Society for Public Health. He has over 27 years experience as a clinician and public health physician and 20 years experience in healthcare practice and management in Ghana. He holds a Bachelor of Surgery and a Master of Public Health degree. He has published several scientific articles in peer-reviewed journals. Ladies and gentlemen, please help me to welcome the Director General of the Ghana Health Service and our chairperson for today, Dr. Patrick Kumar Abuaje, for his opening remarks. Thank you.
Thank you very much and good evening. It is a great honor to be introduced by no other person than the Vice Chancellor of the Premier University in Ghana. Madam Vice Chancellor, Professor Abba Agyepong, our Deputy Minister for Agriculture, Food and Agriculture, Dr. Joseph Agyepong of Jospon Group of Companies and his team of directors present here, our Pro-Vice Chancellors, our moderator, Professor Kofi Tope, a friend of mine, the Dean of the College of School of University of Public Health, a distinguished keynote speaker, Professor Lamte, faculty and staff of the university, the commentator of from the West African Health Organization, Dr. William Bosu, who also happens to be the 4th program manager for non-communicable diseases in this country and also put some fire in it. Our panelists, including my own program manager, Efua Komi, our colleagues, students, virtual participants, distinguished ladies and gentlemen, once again, good evening. The honor done me this evening to chair no mean a function than a second in a series of Joseph S. Agyepong Distinguished Lecture on Public Health in Africa is indeed gratifying. This distinguished lecture series was instituted by the T.A. Chan Department of Public Health of the Harvard University in 2019 to honor a man whose reputation precedes him. Dr. Joseph Sian Agyepong's transformative agenda in turning industries around and improving lives and livelihoods and impacting health outcomes in environmental sanitation space is remarkable, given that about 28% of disease burden in the African region is attributable to our environment. Madam Vice Chancellor, the environment's share of region's burden of disease, however, getting negligible as Africa transitions to a demographic characteristics by increasing prevalence of the non-communicable diseases. A Lancet Commission study into burden of non-communicable diseases in sub-Saharan Africa between 1990 and 2017 found the disability-adjusted life years due to NCD have increased by 67%. These findings have been corroborated by several other studies underscoring the region's complex burden of disease, and I'm sure even the infectious disease of COVID had also shown how NCDs can be a big problem. Madam Vice Chancellor, distinguished ladies and gentlemen, the situation is not any different back here in Ghana. Non-communicable diseases have over the past decade posed a significant burden, contributing to more than 43% of all-cause mortality. Priority NCDs, such as cardiovascular disease, diabetes, cancers, chronic respiratory disease, and mental health disorders have been documented to be on the rise. Available service data shows the number of patients diagnosed with hypertension to have increased by almost 12%, from 172,000 plus to 193,000 in 2022, while the number of new cancers recorded in 2022 increased by 50% from an estimated 16,000 in 2016 to 24,000 in 2020. Ladies and gentlemen, these conservative statistics do not only depict the increasing trend and burden of NCD, but they also represent the myriad of challenges, such as the poor health-seeking behavior of the citizenry, especially men, limited resources, inadequate healthcare infrastructure, and the overall cost of management associated with non-communicable diseases. To address these challenges, I, incidentally, in my role as the Director General of Ghana Health Service, lead multiple teams to try to change the narrative towards prevention and early detection, where the foundation of our health system, that's the primary health care, is being empowered through the network of practice to support secondary and tertiary levels of care in the prevention, detection, and management of non-communicable diseases. We have also incorporated screening of non-communicable disease in the school health concept, work with the World Health Organization to revise the national NCD indicators to align with the global indicators, and intensified awareness creation and health promotion at the community level. And I must say that at the end of 2022, more than 80% of our indicators are being collected at full state, thanks to FYSA NCD. At the strategic level, distinguished gentlemen, an NCD multi-sectoral steering committee has been established, comprising members from different agencies, civil society organizations, academia, Ministry of Health, and following the revision of the NCD policy and strategy. Subsequently, the disease-specific technical working groups are being formed to support the prevention and control of activities for NCDs, in addition to the enactment of several legislative instruments to address NCD risk factors such as tobacco, alcohol, and sugar-sweetened beverages. Distinguished ladies and gentlemen, although these efforts are wide in scope and impact, a lot remains to be done if we are to combat the NDC menace. Dedicating the second series of Joseph S. Agyepong Distinguished Lecture on Public Health in Africa, which coincides with the university's 75th anniversary celebration to Africa's Greatest Health Challenge, i.e. NCDs, is more than appropriate a theme. Even though appropriate are the choices for the even more appropriate are the choices of the keynote speaker, Professor Peter Lamte, and the gamut of diverse panelists to lead this discussion. Prof. Lamte, as per a tribute to his lifelong contribution of global health, is a known global health champion in many lights, with both breadth and depth in NCDs, who more than a decade ago diagnosed NCDs as a poor world's greatest health problem. Prof. Lamte and the panels will require our kind of cooperation and attention as an audience, and to treat us to what promises to be an interesting discourse, to which I have no doubt that will give us our utmost best. On that note, I accept to chair the function and remain grateful for this honor. Thank you.
Thank you very much, Dr. Patrick Kumar-Boaje, for graciously accepting to chair this lecture. We are very happy to have you here. I'm sure we've all heard it being mentioned that this is the 2023 Joseph S. Agyepong Distinguished Lecture on Public Health in Africa. And it's my pleasure now to introduce to all of us, to acknowledge his presence, Dr. Joseph Siao Agyepong and Mrs. Agyepong. You're most welcome. Before we listen to our keynote lecture, I believe it's important to have a word from our partners. And so it gives me great pleasure now to invite up here Professor Emmanuel Agyepong, who is the Director of the Center for African Studies at the Harvard University, to give us a background to the Harvard-UG collaboration and also to introduce our distinguished speaker. Prof.
I stand on all previous protocols. Good evening, everyone, and welcome to the 4th Annual Joseph S. Agyepong Distinguished Lecture on Public Health in Africa. My name is Emmanuel Agyepong, and I'm the Oppenheimer Faculty Director of the Harvard University Center for African Studies and the Ellen Gurney Professor of History and of African and African American Studies. The Harvard University Center for African Studies is a globally recognized interdisciplinary body committed to broadening knowledge about Africa and African perspectives. With offices in Cambridge, Massachusetts, and Johannesburg, South Africa, CAS, as we call it, has the power to influence perspectives on Africa and bridge the knowledge divide between Africans and non-Africans. Our distinguished lectures provides a platform for CAS to partner with our faculty, scholars, fellows, and students to ensure that Africa is at the forefront of conversations, scholarship, and research in very important themes affecting society. Every year, the Center for African Studies hosts 3 distinguished lectures as a way to provide a platform for African voices and perspectives to inform scholarship at Harvard University and to further develop strong collaborations with many partners in Africa and around the world. In 2020, the Center for African Studies launched the Joseph S. Agyepong Distinguished Lecture on Public Health in Africa. This lecture, as you have heard, was generously endowed by Dr. Joseph S. Agyepong. This endowment provides a platform for the Harvard University Center for African Studies to explore topics related to public health in Africa by engaging leaders, policymakers, researchers, and academics around Africa's health and development goals. Through this lecture, CAS contributes to a global repository of knowledge, development of actionable solutions for policy making, and inspires new directions in academic research. Harvard University has a long-standing history of supporting efforts to move the agenda forward for health and development globally, and in Africa in particular. Previous lectures have featured. The inaugural one was by Dr. John Nkengesong in March 2020, who was the founding director of Africa's CDC. And I remember the lecture was on 5th March 2020. We sat in the morning and I would see text messages come on his phone. Another case of COVID in Egypt, another case there. None of us anticipated how COVID would transform our world. The following week, our university was shut down and many places closed. In 2021, Dr. Martin Fregeni, who's the Director of Agriculture and Agro-Industry at the African Development Bank Group, spoke on water for health in Africa, a rights-based approach to development. What stayed with me from the lecture was the statistic that only 3.4% of Africans have access to all the water they need when they need it. In 2022, the lecture was a conversation between Dr. Agnes Binagwayo, who was Vice Chancellor then and co-founder of the University of Global Health Equity in Rwanda, in conversation with Dr. Mohamed Ali Pate, who had been Minister of Health in Nigeria and is now the Julio Frank Professor of Public Health Leadership at Harvard School of Public Health. That lecture was supposed to be given by my colleague, Dr. Paul Farmer. And then in February that year, he died suddenly in Kigali. So this became a lecture to reflect on his contributions and his legacy. Hosting the 2023 Agyepong Distinguished Lecture in partnership with the University of Ghana represents an opportunity to deepen linkages between Harvard University and the University of Ghana during its 75th anniversary. These linkages go beyond this year's celebration. We have helped, and by we I mean Harvard, have helped train several PhDs for the University of Ghana through sandwich programs, and we have hosted postdocs from the university. I am an alumnus of Legon and the recipient of an honorary doctorate from this university. We hope to strengthen our relationship through our shared goals of research and teaching excellence, particularly in critical areas such as climate change, technology, and innovation. I now have the pleasure to introduce my senior colleague and friend, Professor Peter Lamte, our distinguished speaker for today's lecture on non-communicable diseases in Africa. Peter Lamte is an internationally recognized public health physician and expert in developing countries, with particular emphasis in communicable and non-communicable diseases. He is a fellow of the Ghana Academy of Arts and Sciences, emeritus professor of the London School of Hygiene and Tropical Medicine, and president emeritus at FHI 360, which is short for Family Health International. He graduated in 1971 as a medical doctor from the University of Ghana Medical School, received a Master's of Public Health degree from UCLA in 1975, and a doctorate in public health from the Harvard School of Public Health in 1980. He also did a 2-year fellowship in applied nutrition at MIT. He taught public health for several years at the University of Ghana Medical School before moving to North Carolina in the United States to work with Family Health International 360. With a career at FHI 360 spanning more than 30 years, he served as the project director for USAID-funded HIV projects, AIDS Tech, AIDS CAP, and Impact in over 55 countries in Africa, Asia, Latin America, and the Caribbean. Please join me in welcoming Professor Peter Lamte.
Our flagship company, Zoomlion, is a leader in the waste management industry, both locally and in some parts of Africa. These businesses were born out of my passion to improve lives and then to ensure all of us enjoy good health and mental well-being, and that never again should our communities suffer from avoidable sanitation-related diseases.
In the heart of Ghana, one company has been making remarkable strides in revolutionizing public health and contributing to the well-being of communities. This is the story of Zoomlion Ghana Limited and our affiliate companies and our invaluable contributions to public health across the nation. As Africa's leading waste management and environmental services company, Zoomlion Ghana Limited has been at the forefront of Ghana's public health initiatives for over a decade. With a clear vision and unwavering commitment, Zoomlion has consistently worked towards improving the quality of life for the people of Ghana. Waste management takes center stage in Zoomlion's unwavering commitment to a safe environment for all. Through a robust waste collection and disposal system, we have effectively tackled the mountain waste challenge in urban and rural areas alike. Our fleet of modern waste collection trucks, dedicated workers, and state-of-the-art processing facilities have significantly reduced the burden on communities and minimized environmental hazards. By maintaining clean and healthy public spaces, Zoomlion has played a vital role in preventing the spread of diseases and promoting community well-being. Our diligent workforce ensures that market, street, and recreational areas are kept pristine, creating a safer and healthier environment for everyone. Zoomlion's dedication extends beyond the physical realm. we understand the importance of education and awareness in preventing diseases and promoting good health practices. Through strategic partnerships and community engagement, Zoomlion has been instrumental in organizing public health education programs, empowering individuals with knowledge and encouraging positive behavioral change. Zoomlion, recognizing the long-standing challenge of liquid waste disposal in Ghana. To tackle the problem at its core, Zoomlion established Sewage Systems Ghana Limited, a dedicated company focused on resolving the century-old issue of liquid waste management in the country. Through the expertise and resources of Sewage Systems Ghana Limited, a comprehensive and sustainable solution was implemented. Advanced sewage systems were designed and deployed, equipped with the state-of-the-art technology to effectively collect, treat and dispose of liquid waste with their unwavering commitment and innovative approach. Zoomlion, through Sewage Systems Ghana Limited, has revolutionized the landscape of liquid waste management in Ghana. By solving this persistent challenge, they have significantly improved public health, preserved the environment, and set a new standard for efficient and responsible waste disposal practices. In the face of unprecedented challenges, when COVID-19 struck, Zoomlion swiftly responded to protect public health during disease outbreak. Our specialized disinfection services have been crucial in combating infectious diseases and safeguarding communities. From hospitals and schools to public transport systems, Zoomlion's highly trained teams have diligently carried out large-scale disinfection operations, leaving no stone unturned in their mission to create a healthier environment. Overall, Zoomlion's operations have a multifaceted impact on various SDGs, primarily in the areas of health, sanitation, environmental sustainability, and community development. By aligning our efforts with the SDGs, we actively contribute to the global agenda of creating a more sustainable and equitable future for all. Through our unwavering commitment, we have emerged as a catalyst for change in Ghana's public health landscape. Our dedication to ensuring a cleaner, safer and healthier nation is an inspiration to all.
One of my philosophy that drives me is that when you get the role of leadership, it's a privilege. Not that anybody cannot become a leader, but you have gotten that privilege at your time. Use it very well to improve the lives of humanity.
I would first like to thank Professor Agyepong for the warm introduction, but I also would like to extend a special thanks to Dr. Agyepong and the work that you're doing. I'm also delighted to be back on the campus of this university because the last time I was here was in 1966. It makes me feel very ancient. However, we are here to address an extremely important topic, a topic that is going to affect virtually every person in this room one way or the other over the next decades. This discussion, you've heard an introduction to non-communicable diseases, and I've been to lots of conferences, and one of the things that used to come up was that, why do we call these non-communicable diseases? Because of the fact that in starting with the first three letters, non, it makes it unimportant. And actually that may have been part of the reason why this set of diseases have been ignored for so long. I hope that by this presentation and the work that you are all doing, you realize that this is the single most important disease entity in the history of mankind. But before we get on to non-communicable diseases, let me start with something that you're all familiar with. Communicable diseases, because you've seen lots of it over either during your childhood with measles, whooping cough, and the rest, or with HIV, COVID. COVID and HIV over the last 30 years have been two of the most important public health problems in the history of mankind. But I hope that I can convince you that we also need to pay a lot of attention to non-communicable disease. And by definition, these are diseases that tend to be non-infectious, they are non-transmissible, are usually of long duration, and result in a combination of genetic, physiological, environmental, and behavior factors are the result of these. And NCDs usually tend to be invincible because we are not usually aware of them. You could also have it for decades before the symptoms show. But you will realize at the end of this presentation, I hope, that this is a problem that we all need to solve, either at the individual level, the country level, or the international level. What are the characteristics of non-communicable disease? They usually are caused by a variety of factors. That's what makes them so complex. They are non-contagious in origin. They are usually affected by multiple risk factors. They also take a long time before you actually see the signs. And then when you start getting signs and symptoms, the disease usually will last a very long time. Compared to something like COVID or for HIV and some of the more infectious diseases that you're aware of, they're usually of short duration. Most people will also recover. There are 5 major groups of NCDs that I'm going to talk about briefly. The first one is cardiovascular diseases that eventually end up in heart attack or strokes. And we estimate that roughly close to 18 million people die of this set of conditions every year. The second one that you are probably everybody here is familiar with are cancers. And there are a wide variety of cancers, but in total they kill about 9 million people every year globally. And then, as was mentioned by some of the previous speakers, there are chronic respiratory diseases, diabetes, most of you are probably aware of. And then one of the most neglected diseases are mental disorders. And they're often neglected partly because of the stigma attached to them, because of lack of understanding of the true nature of mental health problems. And it's often called the silent epidemic, especially in Africa. Under the cardiovascular group of diseases, I'm going to just highlight a few of them. Coronary heart disease, which are diseases that affect the heart primarily. All of you know about high blood pressure. One of the challenges of high blood pressure is most people are not even aware that they have it until they start seeing complications of it. Cardiac arrest, which is the sudden arrest of the heart function. Stroke, again, I don't need to remind you of that. And heart failure from a variety of causes. But one of the critical factors in cardiovascular diseases also affects some of the youngest babies and infants, and they get congenital heart disease that invariably, especially in the developing countries, has a high mortality. And I'll go on to the next one. The cancer is the second largest group, and I'm going to highlight just a few of them. Breast cancer, usually affecting women. Prostate cancer, so that men can also feel that they are part of the system. Lung cancer, especially as a result of cigarette smoking. Colorectal cancer affects the colon and the rectum. Cancer of the skin, which is more common among the white population. And then cancer of the bladder, as well as lymphomas. This is one of the most important slides that I want to show you that illustrates how important this disease is. This is a slide of the disease burden from non-communicable diseases. And we use the term DALYs, which simply shows both the duration of the disease in a group of people as well as the lives that they will lose as a result of the disease. Okay. So it's an important measure that shows you the extent and burden of that disease. As you see in blue in the middle, cardiovascular disease are by far the largest group of diseases that lead to both morbidity and mortality in both developed as well as developing countries. The second group will be cancers, and I've already mentioned some of the key ones. The third group will be mental disorders, and that is in the mauve color from the top. But as you can see, there are a whole host of other diseases that lead to 80% of the mortality of all populations, whether developing or developing countries. Okay? And this is something that is often neglected. We don't realize how important, how insidious some of these conditions are until you have it and until you start suffering from the ill effects or unfortunately also die from it. This slide shows you all the conditions, non-communicable diseases as well as communicable diseases. But look at the first 4 lines at the top. The largest by far is cardiovascular diseases, followed by cancers. Neonatal disorders is also part of the not part of the NCD group. Other NCDs, and then it's broken by respiratory infections, and then the next 3 or 4. So roughly 2/3 of the conditions that you see here as a cause of the burden of disease are from the NCDs that we are talking about. Even though we use the term non-communicable diseases, and this is a term that has been argued about in different fora, is once you start with a group of diseases with the word non, straight away people say it can't be important. Unfortunately, it is important. And they are not, that is not even true, because there are some NCDs that are caused by infections. Some of them are gastric cancers, liver cirrhosis and cancer, rheumatic heart disease, and cervical cancer. And unfortunately, as you can see from this illustration, Africa bears the brunt of non-communicable diseases that are caused by infections. And that's obviously because of the lower level of development in most of these countries in Africa. What are the principal underlying factors, those that actually lead to non-communicable diseases? And they are simple. Tobacco use, and all of you are probably aware of this, insufficient physical activity, unhealthy diets, and harmful use of alcohol and air pollution. And all these 5 are responsible for most of the non-communicable diseases. And we'll go through to show you how you as individuals can address these particular issues in you and your families before we get to the national and the global levels. You also must be aware of the medical risk factors. The first one is raised blood pressure. And one of the unfortunate things about raised blood pressure is that most of the time, or it used to be, I hope it's changing, that most people who have high blood pressure get to know only when they have a stroke or when they go to a hospital for some other reason. But it is one of the most important risk factors for both morbidity and mortality in adults in developing countries. The second is overweight and obesity. And Africa is fast becoming one of the major we are having the highest overweight and obesity rates in the world. And by the year 2030, Africa will be one of the leading parts of the global community that has this overwhelming problem. That obviously would then lead to some of the outcomes that I've talked about. High blood sugar levels is another, and obviously that contributes to diabetes. But one of the challenges that we have as physicians or as public health workers is the fact that all these diseases I've mentioned are compounded by the fact that our cultural perceptions actually work against it. And I'll go through a few of them. I don't know about you, but when I was growing up, obesity was seen as a sign of affluence. It is not, as you well know now. The second is that we also tend to ignore them in the early stages, and I mentioned the example of blood pressure and some of the other conditions, and we only get to a hospital when things are really getting out of hand. We are also reluctant to undergo health checkups. That is one of the best ways of diagnosing some of these silent conditions. And I remember I was talking to my carpenter a few months ago, and he said he wasn't feeling well, and I said, why don't you go and see your doctor? And he said, oh, if I go, they will find something wrong with me. That mentality, unfortunately, has to change. The doctors not only may feel something wrong with you, but that's the easiest way of actually finding what is wrong with you and making sure it doesn't get out of hand. And we also will realize that one of the best ways of keeping healthy is to have regular checkups. The second, unfortunately, cultural perceptions because of the lack of symptoms of some of these diseases. And this is where we need to educate people that the fact that you look well and feel well does not mean that you're not incubating some of these chronic diseases that eventually will threaten your life. And then we also have our cultural beliefs in local treatment, and that again is a condition that we need to change, because invariably when somebody eventually ends up with a diagnosis of an NCD, they've already tried some other alternatives that are quite ineffective. And one of the most fundamental things I mentioned already, obesity related to our poor dietary choices, and then lack of exercise. There are also global factors that unfortunately make things even more difficult for all of us. Unplanned urbanization, which tends to not only give you poor housing, poor jobs, but also poor opportunities to get good food, fast food being the commonest challenge. And so urbanization and a large proportion of the population of urban areas are usually in poor areas, and they are at greater risk because of some of the things that I've already mentioned. Population aging, we're all getting to live longer, but the longer we live, the more we are susceptible to these non-communicable diseases. I've mentioned fast foods. Fast foods are convenient, but most of them are not good for our health. And then opportunities for physical. Let me briefly talk about some of the cardiovascular diseases. Take a look at this graph that shows you blood pressure measurements. On the left side is the blood pressures in women, and on the right side in men. And as you can see by the darker red colors, that's where we have the highest prevalence. And Africa is overrepresented in this graphic illustration. Obviously, on the second one on the right, you also see Asia and some of the other, and Europe also affected. But this is where we are now, and with a lack of adequate services, this condition is going to get a lot worse before it gets better. I mentioned obesity already. Again, this is another, the distribution of obesity. North Africa and Southern Africa have the worst, but Ghana, obviously, and Ivory Coast, and those in red are also getting up there. And it is predicted that by the year 2035, half of the world's population is going to be obese, which means all the conditions that I've mentioned are going to get a lot worse. And this is the time to realize that we need to reverse this trend before it gets a lot worse. I'm going to mention these very quickly. There are some NCDs that we don't actually think of as NCDs. Sickle cell disease, a big problem in African countries. Neurological disorders like dementia, substance use abuses, which is becoming a problem in a lot of developing countries as well. How are NCDs affecting sub-Saharan Africa in the long run? First, it will increase the cost to households. It makes treatment very expensive. I don't know how many of you are on an STD, whether you have blood pressure, you have to buy your medication, you have to take them every day for 30 to 40 years. Diabetes, same thing. So these are very expensive diseases to have, and unfortunately it makes our work very difficult to get patients to comply to the treatment regime if they can't afford the drugs. Tobacco, I've already mentioned that, and I've already mentioned, but one thing that I'd like to show you very briefly, I mentioned earlier that we all are aware of the diseases that have the biggest names, HIV and COVID. And this is an abbreviation. I was involved in HIV for 20 years, so I know this pandemic very well. But in the duration of this pandemic, which started in 1978, 84 million people were infected. Almost half of them died from AIDS, okay? Drastic impact on not only ill health, but on population. And there are roughly another close to 40 million are living with HIV, most of them in Africa. And there are a lot of people who are still on ART, okay? So having been involved in HIV for so long, I know the impact it has had and will continue to have on our populations. But look at the global response, dynamic. This is all funded by the US government. ACECOM was managed by AED, and they were given $18 million. ACETEC, $28 million for the first 5 years. ACECAP, $200, and IMPACT, $400. And I was lucky to manage all the 3 programs at FHI. So this was a great response to a terrible disease. COVID, same thing. Lots of people infected, 200 million people, lower mortality, but it had a devastating economic impact across all countries. But this is COVID. Look at the economic impact. In red arrow shows you Southern Africa. It dropped their economic growth rates from around 0% to -8 or -7. The other countries in Africa fared better, but they all recovered now. By the year 22, most of these countries were back to where they were before. Look at the funding in all these examples that I'm giving you compared to NCDs. The blue line shows HIV, the response in development assistance to contain it. The green one represents maternal and child health. Malaria is the violet one. And look at NCDs. Virtually no response at all. That's the red line at the bottom. And this continues now. That's part of the reason why NCDs are still a problem, and they will continue to get worse. So just a quick summary of the challenges involved, that we need better recognition by individuals, all of you, governments, communities, as well as the international community to address the NCD burden. 80% of the deaths that occur are as a result of NCDs, and we cannot afford to continue to ignore this problem. The infrastructure, we need to improve the infrastructure to do this, and we cannot rely on doctors and hospitals to address NCD. Most of it is preventive. Most of it is by action by individuals. And we need to learn to do that very quickly before physical exercise, better diets, early checkups. The onus is on us, not on the health system, for us to stay healthy. Finally, Africa, unfortunately, bears the brunt of all these conditions that I've discussed. And we have a what I consider a triple disease burden. We have all the measles, the whooping cough, the chickenpox, all the basic endemic diseases. But we also have had our share of HIV and COVID. And then we have the explosive burden. And this is compounded by the fact that we don't even have enough resources to get up to the stage of the European communities and the other countries. So we have to do better. Otherwise, we'll continue to be saddled by this disease burden. And finally, I don't know how many of you, this slide shows you, according to the Bible, the three longest living people were Adam, Noah, and Methuselah. And they all lived to 900 years or more. Being a scientist, during that time, people couldn't read and write, it was difficult to confirm that these people actually lived. And for you to record the age of these three people, you have to live for a very long time. Okay. From the scientific point of view, Joan Calmed is the oldest human being ever, and she died at the age of 122 years plus. The current oldest living person is Maria Moreira, and she is 118 years old. The average life expectancy for Africa is 60 years. We are a long way away from Adam, but more realistically, from Maria Moreira. And actually, a few months ago, my wife's sister celebrated her 100th birthday, and we went and had a party for her. What is remarkable is that she's been blind for 40 years, and yet has no NCD, she takes no drugs at all. However, as remarkable that may sound, we cannot depend on genes to survive. All of us, or most of us in this room, are going to end up with one NCD or the other. And I've already, unfortunately, that's not my wish, but that's the trend in virtually all the countries we work in. And this slide shows you how for the first 200 years of this period, life expectancy was extremely low, usually around 25, 27 years. We've done remarkably well as a civilization. In the 1900s, it started rising, but look at Europe, America, and Asia at the top, and Africa is still lagging behind in terms of life expectancy. We have to do better. The last couple of slides is that not only are NCDs bad for your health, they are also bad for simply your economy. And the first line says that major NCDs will cause a cumulative output loss of 4.7 trillion. And who is going to suffer the most? Countries that need the money to develop and catch up with the developed countries. And these are some of the things that we need to do to reverse this trend. In summary, Africa continues to have a high communicable disease burden. In addition to that, there's a fast-growing NCD epidemic that I hope I convince all of you is a major challenge to all of us. And we need to reduce the risk factors that put us at harm's way. And I'm not going to get through all of them. But this is the time to take action, and I hope all of you here and others who are listening will hear the message that this is one condition that we need to address immediately. And I would like to thank Dr. Agyepong. I'm really impressed with what I heard yesterday and the fact that you are one of the few people who are putting their money to help reduce NCDs. And my colleague here, my friend, I couldn't be happier, but we are just at the beginning. We are just scratching the surface. All of you here don't have to die or suffer from NCDs. This is the time to act now. Thank you.
Thank you. Thank you very much, Professor Lamte. Thank you. This is a charge to all of us. He's reminding us that indeed the time to act is now. We do not have to die from non-communicable diseases. As I sat and I listened to his presentation, I kept asking myself and telling myself, wow, wow, wow. I'm sure you were also, it was scary at some point, but I think that he's told us that it is our responsibility, our individual responsibilities, to ensure that you do not die from a non-communicable disease. Please, if you learned a lot like I did today, let's give him another round of applause. I'd like now to call Dr. William Bosu of the West Africa Health Organization. He's going to give us a response to this presentation. I believe this will throw more light on what we've heard our keynote speaker say. Please, Dr. Bosu, if you are here, please.
Mr. Chairman, please allow me to stand on the existing protocols. And after such a brilliant presentation, it's such a difficult task to really give this commentary. So I'd like to thank the University of Ghana for giving the opportunity to participate in this year's distinguished lecture that is being organized in collaboration with Harvard University for the Center for African Studies to mark the 75th anniversary of the University of Ghana. Like Professor Lamte before me, I'd like to thank Dr. Joseph Agyepong for his contribution to public health in Africa and for the endowment that is provided for all of this. I am really greatly honored to be given the chance to speak and to give a commentary after that brilliant presentation from Professor Lamte. I was like, after such a brilliant presentation, how can I begin to speak ill of anything that he said in case I become unpopular amongst you? So, unfortunately, he's not here, so I can afford to, and I'm not here either, so I can afford to speak a bit relentlessly on some of the issues that he raised. On a more serious note, I think the objective of my commentary is really to reaffirm several of the important points he made. Without necessarily giving a lecture, I can't do what he's done. He's a distinguished speaker. But also to reflect my own perspective on some of the gaps in the hope that it will overall, as Pascaline said, throw some light, additional light, and how this will bear how all of this will bear on policy decisions relating to NCDs in Ghana and Africa as a whole. So as a reminder, we know Professor Lamte's presentation covered the introduction to NCDs, their global and regional burden. He talked about the impact of HIV and COVID and how we might address the pandemic the NCD pandemic in Africa, and highlighted a few recommendations or a few challenges and ended with some conclusions. I've had the privilege of working in NCDs in various roles, in policy, in programming, and as a lecturer over the past 20 years. So I identify with quite a number of the issues he raised. And I was fascinated by the issue he raised about how tightly non-communicable with none sort of put somebody off, and diminishes the importance of this disease. And I was reminded that in public health, we tend to have that limitation because the very definition of health are indicators for health. We don't have a direct measurement of health. We tend to measure the absence of health. So we talk about diseases, we talk about deaths, and so on and so forth. So it's a real problem that we have. And I was also curious about some of the, because I used to teach NCD epidemiology as well. The definition of NCDs itself has been a struggle. Oftentimes we talk about it being chronic, having a long duration, and kind of gives the impression that NCD sort of travels slowly, whereas we have several acute NCDs. So for example, when somebody takes a lot of alcohol and they're in delirious state, we have acute delirium. It is not chronic, it is acute. When people with sickle cell might be genetic, even have an underlying, but we tend to see the acute crisis that they face. So it's one example of the difficulties we face when we're looking at the definition of NCDs. And as I said, there are also chronic NCDs, chronic infectious diseases. So the word chronic is not only in the domain of non-communicable diseases. We have chronic chronic infectious diseases, especially some of the neglected tropical diseases, leprosy, onchocerciasis, elephantiasis, even HIV. It tends to run over a long period of time. So we really struggle with the definition of NCDs. Another issue I took from his introduction was the whole area of the scope of NCDs. You realize that when he talked about NCDs, there was a focus on 4 main diseases. I'll come to the 5th one in a moment. And it's like that in the literature. WHO, for example, measures the probability of premature mortality, referring to 4 major diseases, these being cardiovascular diseases, diabetes, chronic respiratory disease, and cancers. So the focus is really on 4 main diseases. When it comes to interventions and the lifestyle as well, the focus is on 4, as Professor Lamte mentioned, the unhealthy diets, harmful use of alcohol, tobacco, and what was the last one? Unhealthy diets, harmful use of alcohol, unhealthy tobacco use, unhealthy diet, and physical inactivity. That was the last one. And this has further been developed in a 5x5 approach where air pollution, as Professor Lamte mentioned, has been added on, and as well as mental health. However, when it comes to the burden of NCDs, when we are highlighting contributes to 80% of or 70% of the global burden of disease, it is not these 4 diseases that we see. You saw in Professor Lamte's chart with the bars, the composite graphs, the graphs with the various, there were a whole host of NCDs, digestive diseases, oral diseases, musculoskeletal diseases, whereas many people don't think of these as NCDs. So it's like, for certain situations, we focus on the major 5x5 approach, and yet when it comes to disease burden, we throw in a whole lot of other NCDs that we don't normally think of them as NCDs. The other thing that often gets missing in the presentations is the fact that we tend to think of the NCDs as if the risk factors as if each of them has a linear relationship with an NCD, whereas in a single individual, it can have a mix of several risk factors at the same time. And they don't always operate on the same linear level, they operate in different levels, and some compound each other, and so on and so forth. So that's by way of the introduction. But I was also curious about some of the issues that he raised relating to the burden and risk factors. I was very happy to note financial burden of NCDs, the economic burden in at least 2 of the slides. Because often as medical practitioners or public health officials, we only think of the disease itself, the disability, and the death. So really to talk about the financial burden or economic burden, I think was quite important, because this is really what the politicians like to hear, and in terms of advocacy, and I'm glad we have some parliamentarians in the room. They tend to be more interested in these other dimensions rather than disease burden per se. And again, as Professor Lamte mentioned, they tend to disproportionately affect the poor people. So NCDs are actually more than just a health issue. They are a major developmental issue. And in fact, they're a human rights issue, especially when you throw in things like access to medicines or the whole area of mental health. And no wonder they have now specifically been included in the Sustainable Development Goals, unlike the Millennium Development Goals. And as he highlighted, contrary to popular perception, because they used to be thought of as disease of the affluent, many poor, and recent DHS findings, DHS has wealth quintiles, the rate of increase in obesity is actually highest among the lowest wealth quintiles. So the poorest household, you see a rapid increase in obesity. Whereas when you think about poor groups, you tend to think, they do not have money. How can they be eating some of the oily foods and stuff that generally by popular perception we think contribute to obesity? The other thing we often talk about when it comes to risk factors is the fact that this is increasing across board. So the NCDs as a whole increasing, the risk factors are also terrible. However, we can't use the same brush to treat all the risk factors. So for example, we are struggling with obesity. Obesity virtually across all ages, there is a problem. And there's even an intergenerational effect. So if your parents are obese, it tends to carry through generations. And yet, across Africa, we are not doing badly when it comes to tobacco. Smoking cigarettes has systematically reduced from findings from the DHS. So there we seem to be doing well. But having said that, we recognize there's a new phenomenon of shisha, where young people gather around and they smoke these water smoking and so on, and then they vape in the electronic cigarettes and so on, to reduce some of the smell associated with that. So we have that challenge, but just to say that we're doing well with some risk factors, we're doing poorly with other risk factors. And I was also interested in the intersection that Professor Lamte mentioned, that there was an intersection between infectious diseases. He mentioned 4 different infectious diseases and their relationship with NCDs. And I think this is important because in public health practice, we tend to have this chasm that you have one compartment of NCDs and another compartment of infectious diseases, and they don't really talk to each other. But as he demonstrated, there is actually this intersection. And I think if for nothing else, we remember that during the COVID-19 crisis, there was a lot of talk about NCDs, obesity. These were not only they were not only risk factors, but they were also they had prognostic value. So those who were obese or had chronic respiratory disease or diabetes and so on tended to have poorer outcomes than those who didn't. So suddenly, infectious non-communicable diseases became important in infectious diseases. What I didn't hear much of is, and what I'd like to add is, there's also a bidirectional interaction between mental health and NCDs. And in fact, there's a higher risk of NCDs among those who have mental disorders. One that would come to mind easily is the relationship between dementia and hypertension. There's actually a higher rate of stroke and coronary artery disease or coronary heart disease in those with depression and anxiety. And in fact, people with schizophrenia have 5 times higher rates of diabetes. We do not often think about this overlap. On the other hand, we see that there's also a higher risk of mental illness among those with NCDs. So there's a 15 to 25% increase in moderate to severe depression after a non-fatal heart attack or myocardial infarction. And this is also seen for stroke. There are higher rates of depression in chronic diseases, especially when there is pain associated with it. And depression is a side effect of several antihypertensives. It doesn't finish there. There's also an interaction or intersection between infectious diseases and mental health. So COVID also comes to mind that, in the COVID-19, the mental health and psychosocial consequences of COVID really were important, became really important. And then when you take neglected tropical diseases as a whole, there's also interaction, the mental health effects of NCDs. WHO has a whole publication, monograph on that. So there's also this intersection between infectious diseases and mental health. I would like to focus on the key peculiarities that Professor Lamte mentioned, and add a few of them. He talked about several of the contributory factors, so I didn't go into that. I mean, the trade liberalization and the fast food joints that we see all over the place. However, I'd like to emphasize, because I see parliamentarians here, the unbridled advertising, whether these are billboards or on radio, the advertising is all over the place. The food and beverage industry, all over the place. And one of the effects of this is the diminishing age of onset of non-communicable diseases. So whereas you used to think of cancers in old people or hypertension and stroke and diabetes in old people, systematically the age of onset is decreasing because they get exposed to these risk factors at a much earlier age than during the time of Professor Lamte and I. As he mentioned, there's a higher burden of infectious disease-related NCDs in Africa. The charts also show that more common in Africa than in other regions. And also adults in sub-Saharan Africa are disproportionately affected by high blood pressure. That said, when I've looked at NCDs, now we have about 5 or 6 countries, including Ghana, the picture of higher prevalence of hypertension. The data was actually on mean systolic blood pressure. The systolic blood pressure has to exceed a certain cutoff before you call it hypertension. When you look at specifically at the data on hypertension emerging from recent surveys, you really don't see these figures. The surveys show much lower prevalence than you see in some of the empirical data. Multi-morbidity is also common. So when we talk about NCDs, again, it comes to this compartmentalization. The same person who has NCDs will also have infectious diseases or mental health. So multi-morbidity is common. And what makes it worse in African context, maybe not only in African context, we tend to see diseases. So if somebody is obese or is a smoker, comes to hospital and has malaria, thank you very much, we give you prescription for malaria. The obesity, although it's visible, is not visible. There's no disease column in our health records that say, is this person obese or is a smoker? Or, we really don't care about risk factors. The structure of our health reporting forms is not sensitive to risk factors. We like the diseases, diabetes, hypertension, stroke, and so on and so forth. And then I just like to talk on the cultural influences that Professor Lamte mentioned. And in Africa, it's very important to recognize that we don't like hearing the fact that a disease is incurable. I mean, the spiritualists and the traditional medical providers don't like that. For every disease, there must be a treatment. So the Orthodox practitioners can go on all the talk about disease not being curable. They will tell you that no, that is not true. So that is on one hand. He mentioned the issue of affluence. The affluence is also very interesting when it comes to sweetened beverages, because increasingly when mothers are weaning their children, it's not the old cocoa and so on. We like to give them some Fanta and some Calipo. Some of these, it shows some status that, hey, you're not a cocoa person, Okay, I mean, my time is up, so I'll rush through the few other commentaries that I have. There are challenges. I think it's important to relate the challenges to some of the strategies that we have to combat NCDs. So I'll just highlight one or two and quickly conclude. Prof mentioned the low priority to NCDs, and I like to ask myself, so what do we do about the low priority to NCDs? I think that advocacy is important, and advocacy is not just look around you see people with NCDs. We need solid data to really drive this advocacy wherever possible. And political will is important. That usually political will, it's more romantic to talk about water and sanitation and MRI facilities, mammograms, and so on. You don't really, if you don't have BP monitoring, it's not really, politicians don't talk about that. They like to talk about MRI is this fancy tool for imaging, diagnosing these diseases, dialysis centers, so they're centers of excellence. And these are rather expensive, and we heard in the introduction by the Director General Chair for this meeting that we are looking at a focus on the prevention and screening. We do have the intersection I mentioned. So we do have hepatitis B vaccine that has been in the system for a long time. The coverages are not that good. Generally, in West Africa alone, only about half of the 15 countries have a birth dose. You're supposed to give hepatitis B at birth, within 24 hours at birth. And countries don't even have programs to tackle that. HPV in young girls. Ghana has even had the opportunity to actually not only test it, but also run it as a demonstration project. And yet there's a gap. So we have these low-hanging fruits that are reachable, and yet we do not tap into this. And I think that integration, the whole area of this intersection is to say that there's possibility to really draw on funding from AIDS, HIV, and so on for the benefit of non-communicable diseases. So finally, let me just highlight some thoughts on COVID-19 and HIV so that I can quickly end, seeing that I have the warning time is up. For COVID, I thought it was important for us to look at some of the opportunities that it presents and not just the impact. So when I hear COVID, I hear the intense public education, I hear the integrated approach with different pillars, I hear about surveillance of risk factors, the research that it generated, contact tracing, the local manufacture of vaccines, and to try and reduce default. As Professor Lamte mentioned, one of the areas that we really struggle is ensuring that people adhere to their treatment over time, especially when they are not having any symptoms. And then the high taxes on insulin, the high taxes on life-saving devices. I think it's important to reduce the cost burden, drawing on lessons from the COVID. HIV, in the interest of time, I think one of the things HIV has done, or two other things, is the use of slogans that are missing in non-communicable disease. For example, we have 0 new HIV infections, 0 discrimination, 0 AIDS-related deaths, and then I have U equal to U means that HIV being undetectable means that it is untransmittable. In non-communicable diseases, no such slogans. And HIV has this cascade that you must know your status, and if you know your status, you must be on treatment. And if you're on treatment, it should be effective enough so that your viral load is suppressed. Those with hypertension, only about 70%, only about 30% of them are aware they have hypertension. And the control rates are less than 10%, often around 5%. So we need to have this cascade also for non-communicable diseases. So finally, in conclusion, Professor Lante's seminar lecture covered the key areas of non-communicable diseases and the implications in Africa. I think we need to highlight that gains have been made in Africa in NCDs. The death rates per 100,000 population is declining over the period, and this is based on data from the Global Burden of Disease. We have some opportunities from COVID and HIV. And I think that I'd like to end here and hope that the contributions from Professor Lamte and the little commentary will add and serve as an impetus to the panel discussion that we're about to have. And I'd like to thank once again the organizers for inviting me. And sorry that I've run a little bit out of time. Kwesi, forgive me. Thank you very much for the opportunity.
Thank you very much, Dr. Bosu. What you've done is to scare us some more. But I think that this is a reminder to all of us that we need to take our health very seriously. Before the panel discussion, please permit me to acknowledge the presence of the Deputy Minister for Agric, Honorable Yao Frimpong Ado. Did I get that right? If you are here, yes, thank you very much. And next to him is the Deputy Minister for Health, Honorable Tina Giftina Ayele Mensah. Thank you so much for being here. I see that we have some members of parliament here. Please kindly just give us a wave so we can acknowledge you. Members of parliament, thank you so much for being here. Other government officials, if you are here, please just give us a wave. Let's acknowledge you. Thank you so much. Thank you so much for being here. We also have members of University of Ghana Management. Our Pro-Vice Chancellor, Academic and Student Affairs is here. Prof. We also have the Registrar, Mrs. Emilie J. Mensah, also here. And we have our Provost, College of Health Sciences, Professor Julius Fobil here, as well as our Provost for the College of Basic and Applied Sciences. So thank you very much. If I didn't introduce or acknowledge you, please know that we value your presence here, but because of time, we cannot acknowledge everyone here present. We've come to a very important part of this evening's program, and it is the panel discussion, and this will be moderated by, Prof has a very long profile, so I'll just introduce him as the Acting Dean of the University of Ghana School of, is that Dean? Yes, substantive Dean, sorry Prof, of the University of Ghana School of Public Health, and he also serves as the head of the Department of Population, Family and Reproductive Health. Ladies and gentlemen, please let's welcome Professor Kwesi Tope.
Thank you very much, Pascaline. And as has been said, I stand on the existing protocols. I hope the platform doesn't break. So for this segment of the panel discussion, we really have a distinguished panel. We have Dr. Efua Komi. She is the program manager for the NCD program within the Ghana Health Service. Maybe you can join us up here. Then we have Mr. James Amwa. Mr. James Amwa is organizer for the Ghana Public Health Association. Now, the next panelist is Dr. Fidelia Dake from RAPES, University of Ghana. And finally, we have Dr. Jifa Atta. She is with the Department of Psychiatry in the University of Ghana Medical School. All right, welcome. So to help us in this segment to try and really delve a bit into the NCDs, I'm really going to ask a couple of questions to our panelists. And you have to, what we say, kiss it. You kiss it, you know what it means? Keep it short and sweet. Yes. So, my first question actually goes to Dr. Komi. Now, you take care of NCDs in Ghana, and based on the presentations that have been made from the global perspective, from what we have here in Africa, and then the commentary, can you tell us from where you sit, what are you seeing for the Ghanaian population, and what is the Ghana Health Service doing to address the issues that you have identified?
Thank you very much. So the picture we are seeing is no different from what has been presented. Indeed, for the burden of disease, it has been overflowed. Even within health facilities across the country, when you look at the top 10 causes of deaths and the top 10 causes of inpatient admissions, NCDs feature prominently. Typically, strokes, heart attacks are leading in the causes of death across the country. They are reported by almost all the district hospitals in Ghana. So the burden is no different from what has been presented. Thankfully, this burden was recognized a while back, and I should say multiple efforts have been put in place for Ghana At the strategic level, DG mentioned the NCD multi-sectoral steering committee that has been established. And this involves not just health sector players, but also non-health sector. We have industry people being part of the NCD multi-sectoral steering committee, NGO, CSOs. And the idea is to ensure that for all the risk factors that we talk about, most of them fall outside of the health sector. If you are talking roads, you are talking nutrition, these areas need policy decisions to ensure that the control is apt and appropriate. So these members are part of the NCD multi-sectoral steering committee. And beyond that, technical working groups are being formed for cardiovascular disease, amongst others. Guidelines are being developed for health workers in order to be able to build their capacity and train them to respond appropriately to NCDs, such that if you take a typical CHIPS or health center, anybody should be able to walk in and ask to check their blood pressure. And the health provider sitting there should be able to understand the values they are seeing and to take the appropriate response. So for Ghana, a whole lot is being done. Beyond that, I would want to also add, we did talk about advocacy and the need to have political visibility for NCDs. Thankfully, last year, we did have an international strategic dialogue for NCDs, and this was co-hosted by the government of Ghana and Norway, and it was hosted by the presidency. And this was to ensure that at the political level, we can highlight NCDs and the need to address them in Ghana. So a whole lot is going on in Ghana. And finally, we are having this conversation. This has almost never happened for NCDs. And I think it's a huge step for us as a country to talk about them.
Thank you very much. So to you, James, now I want us to look at unhealthy food environment. I mean, this is really playing an important role in the development of non-communicable diseases. Now, from where you sit, from the perspective of civil society, what are the policy options available to us?
Thank you very much, Prof. So, from the beginning, we've been told by Prof. Lamte and Dr. Bosu that unhealthy diet is a major risk factor for NCDs. And so, if you look at the whole food environment chain, we have external factors and internal factors. It's a duty of government and policymakers to see how they can protect their people. So there are a number of policies that currently we are working on through the Healthier Diet for Healthy Life project. There's one we did through the Advocacy for Health project that saw the implementation of the excise duty amendment bill that was passed around May 2023. What we recommend three policies. The first one is what we call the food composition policy, where there will be a policy to guide what goes into the food that is produced in this country. So, for example, if you go to the production of sugar-sweetened beverage, for example, how much sugar should be in that bottle you are producing? There should be a policy to guide us in all of these. If you are producing biscuit that has salt in it, how much salt should we have in it, which will be acceptable by all? So that policy needs to be put in place. The second one is what we call the marketing policy. And I'm glad Dr. Bosu mentioned that. We see billboards around with celebrities advertising energy drinks. This is something that should be looked at. We have children advertising soft drinks on TV, and they even learn the adverts, and when you are the children are sending those adverts to you, they go with it, and then they end up drinking this, and they end up having these non-compatibilities. So there's need for us to really look at the advertisement of these things. And even what time do you advertise these things? We must take note of it. In Chile, for example, they have been able to have a policy that prevents advertisement of some of these things during the time that children are around. I think I can go in that direction. The third I want to talk about is the front of pack labeling, and that goes also with the issue of food composition. We should be able to tell those who produce our items by telling us how much of the items of concern we are talking about, salt, fat, sugar, how much of them do we have in this product, so that the buyer will be able to make the right choice. So when I go to the market, for example, and they are selling two different kinds of items, I should be able to read and see that this one has less sugar, and so I'll go in for this one. If there's nothing like that, we will not be able to make informed decisions in the selection of what we go into drink. And problem, say this finally, when you look at the fiscal policies, which is also one of the things we do to work on these NCDs, we must take that seriously. And I'm very happy that Parliament helped us to pass the excise duty amendment bill, which looked at increasing the taxes on tobacco, on alcohol, and introduce the sugar sweetened beverage 20% tax. We had to work with Minister of Finance and others to get this bill in Parliament. Even though there were controversies about it, but I must say that Parliament did well in passing it. The purpose is that by having that 20% increase in that sugar sweetened beverage, the prices will go up, consumption will go down, and the money that we get from these taxes can go in to support the healthcare system, health research, building infrastructure to take over our healthcare system. So these are some of the policies that once we put in place, we can serve our people. Thank you very much.
Thank you very much, James. So, I mean, the good news about non-communicable is that a lot of it is preventable. They are what we call the modifiable risk factors, and normally these are behavioral. So, Dr. Fidelia Dake, from you as a social scientist, what are some of the behavioral change strategies that we can really implement to address non-communicable diseases in this country?
Okay, thank you for the question. So, as we heard from the keynote speaker and the commentator, the risk factors are mostly observed at the individual level. So, we are talking about people not eating healthy or not being physically active, or people smoking or consuming alcohol that is harmful to their health. But those end at the individual level. If we want to make population level impacts, if we want to have public health impact, we need to make sure that we are creating an enabling environment for people to actually live this healthy lifestyle that we are advocating for. So at the population level, we need to make sure that people have access to the healthy options that we want them to be able to have. It should be affordable to them, and it should be available also. So when you talk about healthy diets, for example, what is the cost of a healthy diet versus an unhealthy diet? And some of the solution is within our local space. One common example we've had over the years is the issue of local rice. Local rice is whole grain, unpolished, and is healthier, but it's competing with imported rice, which tends to be more polished, has lost virtually all the nutritional value that you can get from it. And all of these are also about policy issues, the enabling policy environment. So how much are we spending as a country on promoting indigenous food production? It doesn't end at production. How do we make it available? So issues of road infrastructure, getting food from the farm to the table. And at the end of the day, what is the cost? So that when I go into a shop, do I pick the less healthy option, but also less expensive option? Those are all issues we need to look at. Issues of global trade. How are we able to negotiate for us to have the healthier options coming in? Issues of advertising. What are we exposing the population to? So that they know that this might be a healthier option over something else. Carbonated sweetened beverages have been highlighted so much, but we don't seem to be making much progress with that. So if we want to really make inroads, we have to make sure that we are targeting the population level. If we do it that way, then we are making the healthier option much more available, accessible, and affordable to the population. And one thing I like to add, we haven't really talked about the issue of childhood obesity in the discourse so far, but that is something that is increasingly growing. And if you look at the intergenerational effects, all of us here could be gatekeepers for our children. So what are we feeding our children at home? What are we exposing? So the problem we are seeing now could be worse in the next 30 years if we really don't address the issue of childhood obesity. And that is one of the biggest population gains we can make in tackling non-communicable. Thank you.
Thank you very much. Excellent point, particularly on childhood obesity. All right. So, it's been mentioned that mental health disorders is virtually neglected. So, Dr. Jifata, what do we have to do differently to change the narrative?
There's a lot that we can do as individuals, and then also as the kind of roles that we play in society as organizations, academics, researchers, and then also policymakers. But one of the things that I want to emphasize on, I think the good professor spoke about it, and then also Dr. Bonso, is education. We need to be able to educate ourselves on what mental disorders are. We need to know what the signs and symptoms are so that we can identify them, and then we can also support people who are struggling with them. It's important that we know how they affect the way we feel, the way we think and we behave, and also relate with other people, how it affects our functioning, and also how it has an impact on our productivity at school, at work. And because that all adds up to the global burden of mental disorders. And I also want to emphasize a bit on early detection and the sort of things that we can do as part of education, and it was emphasized earlier on. We need to start campaigns to increase education or understanding of mental health disorders, because there's a lot of stigma. So a lot of these campaigns, just like we did for HIV/AIDS with COVID, we need to be intentional about it. And we also need to talk about mental health screening. So just like you would do an annual checkup, something that we don't like to do, we also need to be intentional about doing mental health screening. So there always has to be a component of mental health there. If I was to say that after this program, there's going to be a mandatory screening, people will feel extremely uncomfortable, but this is something that we have to do so that we can address it early enough. And in order to be able to do that, there has to be a lot of education and then also training. And I'd also want to emphasize that this has also needs to be backed by research and then also policy.
All right, thank you very much. So I think at this point, we would actually open the floor for the audience to ask questions to our panelists. So where do the mics? So if you have a question, you raise your hand and then they would. Okay, go ahead.
That's an interesting question. In fact, I work with the Department of Psychiatry at the University of Ghana Medical School. And one of the occasions, we did a mental health screening. So we did a hoshishe with the medical doctors, and we had a component where, and this was actually for musicians. So we had that component there. But I would say the thing is to collaborate. So if you want a mental health screening done, you could always contact a mental health professional, and you get mental health professionals in the hospitals now.
Yeah. Okay.
Where's the mic? Oh, you have the mic already.
Yes,
okay.
I have the microphone. Yeah, mine is on nutrition. My name is Professor George Odron Kansa. And the parliamentarians who are here. I'm going to talk about the school feeding program. That's food for them. About whole rice nutrition and the other foods. And I know in education, there's no democracy. So can government make a policy that the school feeding program, the children should be fed with maybe whole grain rice, rice with better nutrition, kose without oil, because I bought kose and I squeezed it, and wow, the oil that came out itself can cook another. So can there be any policy or education, advocacy, the health, you are here, the health, nutrition, so that we stop all this and make our lives better?
Thank you very much. I think this one, our parliamentarians have heard you loud and clear. I think that was Andy.
Thank you very much. I'm Kingsley Amwa from Kingdom Mission for Humanity International. How can we advance campaign advocacy, education, awareness creation across board? We know this has been a challenge within our public health sector. The question is, how do we collaborate together with all actors in all parts of society, talking about the clergy, talking about civil society, talking about private sector, government, academia, coming together to advance so that we can have a common policy to stem this, to fight this non-communicable disease. Thank you very much.
Thank you. Yes, okay. So probably, yes, go ahead.
Yes. Mine is on the fiscal inactivity. The panelists concentrated on food and other things and making them available. But I think that the most important thing is for us as a nation to also encourage the provision of facilities where people can exercise, people can do activities. Otherwise, as soon as you finish eating, you go to sleep, your problem becomes more. Can any of the panelists help me to answer this question?
All right. So I think maybe one last one out there. Oh, okay, go ahead.
Thank you very much. My question goes to Dr. Jifa. Dr. Jifa, I just got to hear of hypnosis and coaching just last week. So I want to know, is it part of mental health redress? Thank you.
Yes, at the back, the last one, then we wrap. No, the back. Yes.
So thank you very much. I know one of the discussions was about looking at taxation on cigarette. But we did some work some time ago for the Ghana Health Service looking at taxation on tobacco. And we realized that the quantum of cigarette that goes through the embassies was the largest of all. And then we realized that they come under protocol. So if you are talking about putting taxation, so the majority of Ghanaians do not smoke. So how are we going to control the quantum that is coming through the embassies and is on protocol? So we need to think about that. Thank you.
All right. Thank you.
Thank you very much.
Yes.
My name is Richard Yali. My question is, so in reference to what Mr. James Amwa said, how does increasing taxes on sugar-sweetened beverages affect or prevent the intake? So from what he was talking about, we want to know how the increasing taxes will affect the intake of these sugary sweetened beverages.
Okay, so I think that will go for the response. Maybe we can start from Dr. Dake. So Dr. Dake, you can start. Yeah, I think the issue of collaboration and advocacy, and then maybe you can also talk about a bit of the fiscal inactivity. Yeah.
Okay, thank you very much. So I think with collaboration, a forum like this is where we start from. We have people from different industries, academia, policy, research, all gathered here. And all of us here serve as ambassadors wherever we go back to. And so addressing the issue of NCDs requires that deliberate stakeholder collaboration and also multi-stakeholder involvement. It should cut across different industries. For the lack of time, we could have gone in depth. When you take every industry, every ministry, you know what role they play, whether they are agriculture, road, health. We all play a different role. And so whenever we have these discussions, we should make sure that everybody is at the table and also highlight how our roles become important in tackling the problem. We shouldn't leave it as it's a health problem. No, it's something that involves all ministries, all industries, and we need to be deliberate about it. Then on the issue of fiscal activity, yes, that's also very critical and important. When you take fiscal activity, you can look at it across 4 domains. So whether you are doing it as recreation, which people tend to overemphasize, but there's also the part about transportation and what we do at home. And so what we are doing, people going out and jogging or being physically active, are being done for recreational purposes. But as a country, we also need to deliberately create avenues for people to be physically active, whether they are moving, whether they are working, or they are just being at home. And those are the parts we haven't focused on. When you take our city, for example, going from one place to the other, most often we are using motorized transport, and you are staying in traffic for long hours. And so when you say people should be physically active, the domain of transport-related physical activity, for example, is something we need to really look about. And it is not just left to the individual. If there is some form of regulation and deliberate interventions on making our transportation systems more efficient, and people are able to stay longer in traffic, or people can rather walk than take a trotro or take their private cars, for example. Those are some of the ways we come in to deliberately create avenues for people to be physically active. Like I said in the beginning, if we leave it to individuals, we won't make much progress. We need to make sure that we are bringing everybody on board and creating a policy environment that fosters all these behavior changes, including physical activity. Right. Thank you.
Thank you. Dr. Jifat, I think there was a question on the hypnosis.
Okay, so there are several psychological treatments. So I'll say that is one. That's a treatment that can be used, but it's also dependent on what you may be struggling with. But then that's a psychological method that some individuals who have been trained to use that method use to treat the disorders.
Okay. Dr. Komi.
Thank you very much. So briefly on creating awareness, and especially with respect to the advocacy for NCDs, we need to be deliberate about investing in advocacy. We need to ensure that we have engaged, most especially local partners. Imagine just driving past the major highway and seeing a huge billboard which is asking, Akwesi, do you know your blood pressure? It automatically triggers certain questions in your mind. What is blood pressure? Have I checked mine before? Or if you have even checked it and you were told that it was high, hey, this high blood pressure they talked about, have I done anything else? It sort of cascades those questions at the back of your mind. So it's essential that, and to do these things cost money. Without investment, it will be difficult getting the Advertiser Society and the large groups to come on board to ensure that these things are available. But we need to take the message to the people rather than sitting and waiting for people to get the diseases and then attempting to treat. So it's essential that we take the message. Prevention is key. We cannot underestimate prevention. And then also to add a little bit to the physical activity bit. With the messaging for NCDs, it becomes a bit boring when you keep emphasizing lifestyle, and we need to make it a bit habitual. So for our children who are coming up, what kinds of habits are they learning even from the home with respect to portions of food, with respect to achieving a certain number of exercises? A colleague just came back from Japan, for instance, for a conference, and they were given Fitbits, and they were expected to have a specific number of steps before the end of the conference. So he was all excited that, oh, he has overachieved his steps. Now they finished the conference and their Fitbits are analyzed, and he was told that he only had 20% effective steps. throughout the whole conference. So even we might think that we are walking, but are they effectively reducing our weight? So these things, we need to be deliberate in talking about them and then in putting in interventions to address the risk factors, ultimately to ensure that we can bring down the burden of NCDs.
Thank you. Thank you. Then James.
So, Prof, because you asked me to kiss the point, there's one I didn't kiss, so let me talk about it briefly.
So,
that is the food provisioning policy. And I'm happy the issue of school feeding was mentioned. There should be a policy regarding public procurement of food to public facilities, our hospitals, our schools, our orphanages. Let me give this example. My child was sick about 2 years ago. We were in a hospital, and we were told by the nurses there's someone from America who is celebrating her birthday, so she has to give us items like donation. She brought some things out, some were biscuits, some were drinks. The first thing is that they were 1 week away from expiry date. Number two, all the drinks they brought had too much sugar in them. Some were over 30 grams of sugar per 100 ml of the drink they gave to the children. Thirdly, the salt content in them was overwhelming. But there's nobody to check and see that these items are donated to children who are even sick, are not healthy. So there should be a policy to guide all of these things so that we'll be able to have, healthy people to live in this country. The last thing is a question about taxation. There's evidence to suggest that if there's increased taxes on commodities, consumption goes down. So, for example, if this bottle costs 5 Ghana cedis, you can buy 5, and you have 10 cedis, you can buy 2. Supposing it goes up to 7 Ghana cedis, you can only buy 1. So it means you need more money to buy more to satisfy how much you've been drinking in the past. But because the price has gone up, the ability to buy will also go down and consumption will reduce. There's evidence in other countries, in South Africa, in UK and other countries to that effect. So we've started with our own in Ghana in May. We're expecting that by next year or so, when we start doing the review, consumption should go down and more Ghanaians should start staying healthy. Thank you very much.
Thank you. So James, since you have the mic now, I want your closing remark. 30 seconds. Sharp.
Thank you very much. So I think that we need government agencies and policymakers to agree with us as CSOs. Luckily, academia is on board with us. We need government intervention. And I think as a country, there are certain things we shouldn't add politics to them. So I was a bit disappointed when it came to the extradition amendment bill. There's a lot of politics around it. And even at the time it was being passed, we were all on our nerves watching TV because we were scared as to whether we passed or not.
30 seconds.
These issues must be looked at nationally so we can protect our people. Thank you very much.
Thank you. Dr. Kwame, 30 seconds.
Thank you very much. So I would like to applaud this opportunity that is being provided in order for us to further talk about NCDs with this wide array of audience available. I think that one key question we need to answer is how much Ghana is losing as a result of NCDs. We need to ensure that we can quantify how much of our GDP is going down the drain because a lot of people are coming down with stroke, and as a result, we are losing monies related to NCD. It's not just about the medication, loss of productivity, missing hours. It goes way beyond. So we need to answer the economic question related to NCDs. Thank you.
I'm very happy for this opportunity because we are educating the public. I would want to say that we also need to be innovative. Wherever there are challenges, there's also opportunity for innovation. So let's try and leverage on some of the new techniques, digital space. How can we use social media to create or increase public awareness about NCDs? Let's leverage on some of these opportunities.
Thank you.
Okay, thank you. So to all of us here, let's go back and make the healthier choices for our own lives. Let's be ambassadors wherever we go to speak for NCDs. And for our policymakers here, let's make sure that we are bringing NCDs to the table and putting in the necessary interventions to make a healthy population. Thank you.
Thank you. So, I mean, this discussion has taught us a few things, that NCDs goes beyond just health. And for us to make headway, we need to be deliberate and intentional. We need to make investments, and we need to be innovative. Colleagues, ladies and gentlemen, join me in thanking the panelists for their great input in this. So, over to you, Madam MC. Thank you very much.
So please, let's keep applauding as they walk to their seats. We want to thank you very much for this informative session. And for Prof, thank you for moderating it so beautifully. I think we were able to look at the very important issues without spending too much time. Thank you very much, our panelists, for making time to be here with us. We are gradually drawing to the close of this evening's lecture or event. And so I would like to call the chairperson to come forward and deliver his closing remarks.
Thank you very much. I think we've been given a lot of information that I will not dare attempt to summarize. I believe that Dr. Billy Bosu did the first summary, and so that was reinforcement. But there's a lot that I can also take from here that I think we should all go home with that. That we have, as a country, we have a triple burden of disease. We had infections, we have an explosion of NCDs, and I think we knew it, but we only realized it a bit late. There are key challenges, and I think these are the things we need to look at. One is the cost of care. The cost of care still remains catastrophic, and if you look at some of the studies we've done, one disease, NCD, can virtually collapse a household. And that is what drives people into all kinds of alternative treatment that do not work. Our health-seeking behavior remains a challenge, and so there's a need not just to speak among ourselves as experts, but also speak to the people and make sure people get to know why we are doing that. The major problem is on malnutrition. Malnutrition in the sense of obesity, and most dangerously is the childhood obesity. The DHS have been telling, especially in Greater Accra, where we are having an increasing number of children who are obese. Obviously, once you develop a fat tissue as a baby, when you grow up, it's waiting for it to explode, and so that creates a problem that we must look at. There is also the issue of alcohol advertisement, either as aphrodisiacs, and most dangerously, as something you eat, you take and eat. And if you are drinking alcohol to eat, then you are in big trouble. You're eating 3 times a day, and if let's say even twice a day, you have to take some budidi. You know, that's what they call it. That is very, very dangerous. And when you see the advert with the meat and the fat and everything with a big bowl, these are habits that we must all speak against and ensure that it is not going to help us. There have been several, of course, the sedentary lifestyle has been highlighted. This is an area we all need to look at. So the response is more of not just about us, we have to go to the whole society, and that's why we have agreed that everybody must speak to them in the language they understand, so that we can all change our lifestyles. We must have places where we can walk safely. I think all our parks are disappearing. We need to start creating parks that allows people to really go and have a walk. There's a need, and I'm sure Harvard can also help us, to advocate for to reduce the cost of care. Until that comes up, it's going to be a problem. As we look at medication, it becomes a problem. We must also enforce the non-medical approach to reducing NCDs, but most importantly, let's make sure there is a cost care is reduced. We also focus on screening, and we have, as part of our response, we have started screening, and we are doing some program currently where we are focusing on screening and also giving facilities specific amount of money to be able to do health promotion, including screening of people. Look at that. We are starting a wellness clinic, which has started already, and we hope that people will take advantage of the wellness clinic, whether you go to the facility with a relative, you can go and get your BP and your sugar checked. These are all areas we want to emphasize. And I think our approach as a health sector, and so if Welcoming has just given her own performance appraisal status for me here, so we'll check on that next year. Our approach to care is extremely important. We are waiting for patients to come. I have come from the stock of MCH, where we don't, maternal and child health, we don't wait for patients. If you don't come, we come and look for you. If you can't find you, go and find you in your farm or in the school. And that is what we need to look at, addressing the design of the strategy for addressing NCDs. We have to do the life course approach where we are not just focusing on children, but we are focusing on all the segments from the elderly to the child, to the men in their 40s who seem to be missing in the health sector. But we need to make sure that we have that complete. Currently, a lot is being done. NCD is already in the health insurance package. People must take advantage, they get insured, and so that they can take advantage. We have included all the health NCD systems in our essential health package, and so it's a good start for us, and we hope that people will take advantage of that. And we also want to ensure, and as academia, I think we need more information, we need more knowledge. So we need to have a research agenda so that we can continue to provide more information and strategies to address NCD. So with this, I want to thank all of you for the opportunity, the university, Harvard, Jospon, the Vice Chancellor, for giving me this opportunity to chair this wonderful occasion. Thank you very much.
Thank you very much, Chairperson. I come here at this moment bearing good news. I've been asked to inform you that Dr. and Mrs. Agyepong are pledging to donate an amount of 500,000 Ghana cedis towards advocacy for NCDs. Please, let's acknowledge the contribution. I'm sure that in the coming days, the modalities and who's benefiting or who's going to use this fund will be made known. Thank you very much for that contribution. It's time for us to make some presentations to thank all those who have performed special roles in this evening's event. And both the Harvard University Center for African Studies and the University of Ghana will be making presentations. So I would kindly ask that the presentations be brought forward, and would call our panelists one after the other to receive these presentations. The one from the Harvard University Center for African Studies will be handed over by Professor Champong. Prof, please, we can join us here. And I'll kindly ask our Pro-Vice Chancellor, Academic and Student Affairs, Professor Gordon Awandare, to kindly do the University of Ghana one on our behalf. I know that we are not all getting them, but we can clap for those who are receiving them. They just might want to share them with us. Thank you very much. So we will start with the... Professor Peter Lamptey, I would like to kindly call you to come up. So, Prof, yes, please go ahead. Thank you very much. Dr. Bosu, if you can kindly join us here to receive the second presentation. Professor Tope, please, if you can join us here. Okay, next, we want to kindly ask our chairperson, Dr. Patrick Kumar-Bwaje, to please come forward. And then next, we'll call on Dr. Ifwa Kome. Please kindly come forward for a presentation. Mr. James Samoa. Dr. Fidelia Dake. And last but not least, Dr. Jifata. Thank you very much, Professor Wandari and Professor Champong. Thank you. Thank you so much. As we mentioned at the beginning of this evening's event, this program is part of activities marking the 75th anniversary of the University of Ghana. And I now have the pleasure of inviting the chairperson of the 75th Anniversary Planning Committee, Professor Akosua Adomaako-Ampofo, to appreciate all of us, to say words of appreciation, and also to give us a few announcements. Please, a round of applause as she comes forward.
Thank you very much, Pascaline. Prof. Lamte, I'm not sure that I want to live to be 100. I'm not sure about folks here, but I know that I want to enjoy a good quality of life. Pascaline said we had been scared. I hope we have been sufficiently scared that we will do the right thing for ourselves and we will go out and preach the messages. We will not be like the carpenter who was referred to who decided he wouldn't want to go and find out what was wrong. And I hope we'll go the extra step and actually get our annual checkups, something that we don't do. There are some very influential people in this room, and so I cannot let this opportunity go by. There was an NCD that was not mentioned, and for young women and girls above a certain age and younger than me, 5 to 8 days every month, they have something that compels them to use a sanitary towel, but if they do not get enough, they can get an infection. And so I am here to plead with those who have the power, IMPs, to both remove the taxes from the sanitary towels that we import, as well as the taxes for the people who make them locally, so that our young women and girls, who are more than half of the population, and at least half of those have their period, will not need to suffer from these infections. Thank you very much. So, some thanks and announcements. So our deep appreciation to you, Professor Lamte, and our responder, Professor William Bosu. Where are you? There you are, right there. And of course, our panelists, Doctors Atta, Komi, and Dake, and Mr. Amwa. Thank you to Dr. Patrick Kuma Abwaje for chairing, and able moderator, Professor Tope, for moderating the panel. Our nimble MC, Pascaline. If I was not already married, I would have asked you to MC at my wedding. Thank you to the planning committee, including the team from Harvard University, especially Professor Emmanuel Agyepong and Madam Rosalind Salifu. And the Agyepong family, where is the Agyepong family and Jaspong group of companies? Thank you very much. And also for your recent incursion into the donations here for the work that we all want to do on non-communicable diseases. We are very, very grateful. Thank you to our media partners, Multimedia, Joy FM, Radio Universe, our own University of Ghana station, Metro TV and City FM, and colleagues who went to all these stations at very short notice to talk about this program and NCDs. Special thanks to the School of Public Health, the Dean, Professor Kwesi Tope, and Professor Richmond Aite. I don't know if Richmond is still in the room, for helping us to put this program together. We are really grateful. The UG at 75 Secretariat, extremely grateful to you all. And we have an office. When we say Secretariat and committee, it sounds big, but the Secretariat is a two-woman team. So I want to thank Mrs. Joanna Omabo and Ms. Sharon Adokwe-Tego for being, it looks like they have 48 hours in their day. Thank you so much. And Pascaline, of course, and the Public Health Director and the Public Health Secretariat, as well as my indefatigable co-chair, Professor Clement Apa. Where are you, Clement? You see, he's indefatigable, so he's always missing, doing something. But he'll be coming back to show you something. We want to thank the Ghana Dance Ensemble from the Institute of African Studies, where I belong. They always come to grace these events, and we are extremely grateful to them. And to all of you, ladies and gentlemen, for coming, because if you were not here, we would not have this conversation, this important conversation that I know you are going to take away. They say when you hear the cock crow tomorrow, it means that we are thanking you. If you do not hear the cock crow, it means that you enjoyed the program so well that you were sleeping when the cock crowed. So thank you very much. I want to share some upcoming events with you, and I hope that this is working. This is just some pictures of things, activities that we have already had, a small slice of what we have already done that you will see here, and some upcoming events. I don't know how well you can see it on your slide. In a couple of days, we have a panel at the Great Hall at 4 p.m. Please be seated at 3:45. It's on the Day for Scientific Renaissance, and we'll be looking at our theme, Nurturing Resilience, Embracing, Adopting Technology and Embracing Humanism. We'll be looking at that on Friday, the 29th of June in the Great Hall. The SRC have their week from the 15th to the 22nd of July, so be looking out for their activities, especially the students, but not only the students. Then we want to give back to our communities. So on the 21st of July, the University of Ghana will be giving back to the community. We're going to do public health education, talking about many of the things we talked about today. We'll be doing some basic health screening and offering some counseling services at the Medina Market. Between the 24th and the 28th of July, there will be an exhibition showcasing the University of Ghana's rich biodiversity. You would be surprised the diverse plants and animals, birds particularly, that we have on this campus. So that exhibition will be opened. From the 24th to the 28th of July, we'll be having staff and alumni games, including football, basketball, volleyball, hockey, and swimming. If there are any students who want to challenge me at breaststroke, please find me there. And then we will have a climax of our activities, Thanksgiving service, interdenominational Christian service, and Muslim prayers on the 11th of August, 2023, in this very conference hall. At the end of the year, we will gather again to chill. And when we chill, we will be doing some eating and drinking. We will make sure that the sugar is not too much. A little bit of alcohol will be good for the body. And then we will launch a legacy project to make sure that we all remember that UG at 75 happened. Thank you very much for your attention. I said I would call my indefatigable co-chair, Prof. Aha. He has something to show us, a little late in the year, but not too late. One professor told me, Professor Asare Opoku, who was my senior colleague when I joined the university, he said that when the thing happens, that is the right time for it. So,
thank you very much, Chair. So I'm here to show you the cloth. A senior colleague once said, "Hey, anniversary won't chatham." All right. So So we have two different designs of the cloth. That's the first one. So you can hold that. And the second one. Upside down. Okay, so there's the second one. Maybe you should come here for more people to see. So that's the second one. Anytime from Monday, you can purchase this. They are all in now. You just have to. We'll inform you where you can buy it. And a yard is going for 35 cedis. Not very expensive. This is real wax print. So if you're a UG alum, current UG student, UG affiliate, which sounds like everybody here, then please, you're welcome to come and purchase this. Thank you very much.
Thank you very much. Indeed, UG is 75, and we are happy to celebrate our anniversary. We've come to the end of this evening's program. I hope you all agree with me that this has been a program worth spending your time at. We've all learned a lot. We've been reminded about many things, especially relating to taking better care of ourselves. I just want to let you know that the full anniversary program or highlights of major activities for the anniversary are on page 19 of the brochure if you have a copy. And so please kindly join us anytime you hear of an announcement for any of our anniversary activities. So as I said, we are at the end of this evening's program. After the university anthem, we'll kindly ask dignitaries to stay behind for a group photograph up here. The photographers will try and capture as many of us as they can. Afterwards, there will be refreshments in the foyer for students and guests. up there in the foyer. The foyer, if you use the stairs up, the foyer is right behind the control room. And we would kindly like to ask all the speakers and the chairperson, the Dr. Agyepong and wife, as well as members of university management, to please join us at seminar room 2 for their refreshments. And also to let you know that if you want to interact with any of the speakers right after the university anthem, they'll be around for a few minutes. You can come and interact with them before you leave this hall. So thank you very much for being here this evening and for heeding to our call to be part of this lecture. I'll kindly ask that we rise for the university anthem. It's on page 19 of our brochures. Thank you. Thank you very much. We'll now take some photographs. And I forgot to thank the Department of Economics and the management of the CD Conference Center for always welcoming us anytime we have our activities. Please, we appreciate your support to the 75th anniversary, and I must emphasize that. Thank you very much. We'll kindly ask our dignitaries to come forward to the stage for a group photograph before you leave. Group photograph, please. Dignitaries, we need you here. Yes. Okay. Please, Dr. and Mrs. Agyepong, our panelists, members of university management, please, we need you here for the group photograph before you go.
Metro TV, insightful and inspiring moments.
Leadership is the fulcrum around which all human development efforts revolves. Whether seen at the personal, national, or geopolitical and economic development perspectives, it remains a central enabler of all successful and sustainable development efforts. Join me live on Metro TV and VOL online radio every Thursday as we explore the germane and pragmatic rudiments of leadership, teamwork, and change management strategies for the betterment of our society at large. I am Dr. Victor Abbey, your host. Be my guest as we learn, unlearn, and relearn to accelerate the development of our society.
Leadership 360 is brought to you by GOL, V5 Solutions Limited, and FV Global Consults.
What premium shall we place on our health? Is it to wait and get hit with a condition? Or on a daily basis, how do we check the body before health slips away? Living Well is the lifestyle series that will help you get tips to some health issues. My name is Ethel Poplampo. Join me every Saturday at 10 a.m. on Metro TV for the Living Well show.
Hello and welcome to this week's edition of Community Watch here on Metro TV with me, Gabriel Ni Obodaya Topra Atunam Togba Shonkwa Osonu. And in today's edition, I am with Rosemary Koko Anyigba, Dolita Na Kokoi. Yeah, right here with me, and we happen to be in a rural part of Accra at a point called Otuaple and again Kojo Ashon within the Ga West municipality. Kojo Ashon, Otuaple and neighboring areas, and there are a number of challenges that this rural community is faced with, and for which we are here to highlight them and then see how best that they could be addressed. Na has been here about a month ago to highlight the situation, but nothing much has been done about it. Hello, Na. So before we engage the residents here, bring us up to speed. What did you find when you came over here about a month ago?
So when I got here about a month ago, I realized that the bridge had some issues. Most of the plates on the metal bridge had removed, and it was hard for cars to use the bridge. In fact, it's very dangerous to drive at night. The roads are also very bad. There are potholes in most of the roads, and it makes it harder and longer when you have to drive using this route.
And now there is a truck coming which is struggling to use the bridge. So the bridge is a challenge. It's in a deplorable state, followed by the road. Having heard from Nakokoi, we will now be inspecting the bridge so you have a better appreciation of what we will be sharing with you. The leadership of the two communities, Otuaple and Kojo Ashon, is ready here. The leaders are ready. So we will get to the bridge, inspect it, and then come back to continue the program. So now, let's move over there and then inspect the bridge. You find out where our inspector bridge. So that's a car coming. We are demonstrating the situation here to you at first hand. See the difficulty involved. Very risky. So here are the young people. That's a very huge boulder. On. This is the bridge we are talking about.
Yomoko, Lele. Say Yomoko bagbemi, Yonupa bagbemi. Neke no ni ne ya happy ya shalaja. Ashalaja ma bridge no lakai. Tipa ya gbemi leke gbome boy that agna bako wan pa fai, wan pa mna do fai. Wan pa je fai wan ye ba bako wa ake. Woso moko bagbo. Bridge year no year no ahuno na aka gbene ni efema. Ni bedi ni emi efamo e wan wo wan pa je fai e teme wan pa je fai.
So residents here are deeply terrified about the situation, and the gentleman you heard earlier made reference to an incident that happened in a neighboring community called Ashalaja, also within the Gan West municipality, where a bridge like this collapsed and people died as a result. So it's a major challenge here for which we would want to draw authorities' attention. Having inspected the state of the bridge, let's now get back there and then start the conversation proper. You find any way back no wajia was an igba shishi.
Me hanya fe o manye asha nyonkombe ne na kokoi ni di nabi dorite ba ba slami ke o amba slash fe be de ba na bridge anu kwa tu ifa e ke queen mother e manya allo grandma mini yo je baba agbe mi nika wo tete me san ke bani amba ya me buawo e wo le ke kwe le ye gbeku le ba nye ye ke buawo e fine e tu e hawo no lele le te ye beku le ahane atule le ba survey ni bi efen doji nmene dromona le ke ba kwa bridge ko ni ye le ke buamo na me yo mi ko na me akwahe na ba chochoen ba chochoen ko na ji abuawo bona fe ni ne ke bridge ne dani moko ba gbe mi asa hawo wo ba ke wo mo nu pa ifen wo ba ke wo oblahin ko blaye wo ba ke madian cheme ke ni ne madian me fe wo ke wo pa fai wo pa government e fai ko ni fian na ba na yeli ke buamo ye koju ason o to a plan bridge aji abuawo.
So that's the Queen Mother of Onyansana, Queen Mother, saying that the situation here is concerning. It's worrying. The bridge is in a very deplorable state and it's life-threatening, for which she's appealing for urgent attention to have this bridge fixed for them, and they wouldn't want to see a disaster striking before authorities would rush in and then have it addressed, and mention that, look, they are well represented. The Queen Mothers are here, the Chief is here, and as well opinion leaders and young people, all in a bid to ensure that their pleas are heard and for the bridge worked on. So there is a young man on a motor who is complaining bitterly. Young man, come. So upon sighting us right here, he's been complaining
saying that they've been talking about the bridge over and over and over again. We will be speaking to the chief of Kojo Ashon briefly, but I've asked this young man who has just gone off from the motorbike to then share his frustration with us. You were on the motor complaining, what exactly is the problem?
Please, we wanted to do something about the bridge for us because I'm a tipper driver. We used to pass here most of the time, but as I'm talking to you right now, there's no way here. They have just blocked the road. When we wanted to take another road or another way, we have to go long distance before you can get a load. Please, when you go to the place when you load, you have to pay council tickets. After the council ticket, what is the meaning of the council ticket for us? Is it not the maintenance for the road and the other stuff for us? So please, try and do something for us. That's why I'm talking, not that I'm just talking. Please. Thank you.
Have a reason to then speak up to ensure that this road is fixed. You've been paying tax. So thank you very much. And we wish that it is fixed for you. Now let's get to Kojo Ashon's chief.
Because MC in your BNA, Nilante Wickinson, Lady once in your BNA, one can make here, one qualify neighbor model, what assemblyman in your BNA, not a make, not a fake benao. In your more family, you know, Tramaniaba.
Yes.
I'm the chairman of the union.
Oh, okay, of the drivers' union here. So, how concerning is this to you? We've heard from some of the drivers here, but share insight into this with us.
This bridge was constructed very long ago, and some time ago, about 5-6 years ago, we had the same problem here, that the community have to come together to fix the bridge. Afterwards, nothing has been done to it, and we are still facing the same problem.
So at some point, you mobilize yourselves as concerned residents to fix it?
Yeah, that is it. And we're waiting for the government to do something about it. You can see the condition of the bridge. It has been there for many years. No maintenance, and it's so small for the community as the community is growing.
What step as a leader, because it's your members who use this route most for their livelihood. So what step have you taken?
We've consulted the council, that's the West Council. We've been there several times talking to the urban transport director. We've seen the MP over here. We've seen the DC, MCE over here. We've talked to them, but they always give us a promise, as it is. We shall be coming, and we've seen nothing about it.
Well, at least you've taken steps to ensure that this is fixed. And what we are going to do on Community Watch is that right after speaking to the residents and inspecting the situation and bringing you a first-hand situational report, we shall meet with the Municipal Chief Executive for Ga West, that's Nilante Wilkinson, to then seek answers from him. Why is it that he, together with others, have been promising the people of Kojo Ashon, Otuaple, Onyansana, and other neighboring communities? So there are two persons seated on a motorbike just passing by, and we're saying that Mumbeye Maye, my tree is very bad. But, well, I got the understanding that they were appealing for these personalities I was calling, that's Nilante Wilkinson and other key leaders, to listen to their plea and come over and fix it for them. For some reason, the assembly member here is stuck at a distance, and the Queen Mother here is calling, inviting him over, that you need to be here. You need to speak to us. You need to explain to us what you've done about this bridge. Honorable, you are representing the people at the Municipal Assembly. How come the bridge has existed in this state for years, and yet nothing has been done about it.
Yeah, thank you very much. In fact, this bridge was constructed 1990, far back, which was a temporary bridge linking Kojo Ashon community and then Otuapre community. Since then, you see, there is low tension of the population-wise. But currently, as I'm speaking to you, we know it's a rapid development. Those days, maybe by the close of the day, only 2 cars will pass on this bridge, somewhere 1990 to 2000. But as I'm speaking to you, a day, over more than 500 cars patronage on this metal bridge per a day. In fact, because of the rapid development, now there is a need of construction is going on, building, other things. So in fact, heavy trucks used to pass on it. We have a tipper truck that convey laterite and then sand to the various community. We have the heavy trailers also who distribute cement and all other things. You see, no matter how it is, we can't stop them that they shouldn't pass on it, because so far as there's a development, structures also must go on. So what we are pleading for the government is that the temporary bridge should be converted into a concrete bridge. So far as the road is concerned, we were told 4 years ago that one contractor called Memphis has been awarded a contract on this road. For that matter, we want to plead with the government if this bridge, metal bridge, can be inculcated in the budget so that we can have a concrete metal bridge, but concrete bridge, but not a metal bridge, so that in future it can fit the community, it can fit everybody in the area. Even when you are looking at the stage of the bridge, if right now, looking at the population-wise, a car is passing, and one from maybe Kojo Ashon, one also from Otuapre, this means that one have to stop until all the rest of the cars floating from Kojo Ashon to Otuapre, the other ones, they pass before. For that matter, we are pleading for the government. We know that he has done a lot, but still the cake that is sharing, if it is small, we the people of Kojo Ashon and Otuapre community are saying our cake or the part of it should be given for us. Thank you very much.
So the assemblyman is just like the others, saying that, well, he's represented his people very well. He's done his best to ensure that he brings the attention of the authorities to the plight of their people, but he was told that this road had been awarded on a contract, and as a result appealing that it is factored into the project. And if this road has been awarded on contract 4 years ago, and yet we are still seeing potholes, we are asking that when is the project, has the project taken off, started?
So the project started 4 years ago.
And has it ended?
For the interim, it has not been tendered.
Okay. Okay. So the project came up 4 years ago, and we can't say much about it as of now. Thank you for staying with us here on Community Watch on Metro TV. We are currently at the mid of this stretch of road from Kojo Ashon to Obom. And so we have some elders from Obom and Pomponno joining the elders from Otuapre and Kojo Ashon, and also from Onyansana joining, and we want to then know how the state of the road is affecting them. But currently I can see a car approaching, so let me quickly dash to then speak with this driver and revert to then speak to these elders.
I'm Ben. I've been plying this road quite often. The road is too bad. Even where we have the third road, the potholes in the third road is even worse, and let alone this part. When you move towards the end, you can see that the road has so crumbled to extent that even if you are using a very good car, you can't even move freely. I don't know if the state or the assembly want to do something about it for us. Yeah.
In your estimation, how many minutes, or well, even if hours, would it take if this road were to be tarred? And now, how many minutes it takes you? Let's appreciate the dynamics.
From Trade Junction to the junction here, Obom, Trade Junction can take you just about 50 minutes to here, or even 10 minutes. But it's taking me almost an hour to get from Trade Junction through, in fact, I tried to use Akraman, through this place up to Kojo Ashong, up to Obo here. It's taking almost about an hour. I left close about about 2 o'clock thereabout. It's 3:16. I've just gone to the place and I'm returning. The road is just too bad. The government has to do something for the people in this area. Even if they won't tar the road and they will just get a grader to level it, it will make movement on it a little better for us.
Thank you very much.
My name is Ebenezer from Kofikwe, Youth Chief of Kofikwe.
Okay.
And then this road from Obom to Kojo Ashon is very bad. They started it on, I think, last 4 years, and they couldn't finish. See the holes over here. And then when the rain fall, we have River Adeso here passing here and Pompono. This time we are in rain season. But actually when you see the holes and then the road, the potholes are very bad. We have the chief executive from Amasama constituency, Kremet.
The Gan West Municipal Chief Executive.
Yeah. And then Domi Abarabum, Chief Executive, Nyani. They don't do anything at all. We are suffering here. Even when rain falls here, we can't cross this here from where we are standing to Obom. So we are suffering. So we are praying the government to come and do something to it for us so that we will be okay and then we will feel happy here that we have government or we are voting for a government. Thank you very much.
But are you impressed with the level of response or attention being given you by central authority on this stretch of road?
Oh, actually, it's not good at all. And then we want them to come and do the road for us and then tire it for us and then asphalt it for us.
Nikokwe road there bonde kanshie mobo ni kaje 4 years ne na wa fe road na kwa shibie ni amefe ne kan ma covet ne kedi biye wona dokodon ko to bi egbeke no ya dangerous abanya fobo egbe na no ni aho ni bi yo de bona won kpafai wa ke amele ake bi efita gan he ameke wo koni wale woni obafi si boni ni ya le wo nkpafai na mba kwedo ko fi ha wo bi e towo ke mboko je ake mboko ha le emergency alo moko ana emergency ko hospital ko na kele mba ogbo mobo onu wo nkpafai ni amekwe na amefi no ko ya wo.
Okay, so he's spoken about 3 things. The first being that it's very difficult to convey sick persons for further treatment, and he feels that it's not the best. And also he mentioned a security situation that because it becomes difficult for vehicles to ply this route and such that if it should ideally take commuters about 20 minutes to use this road and that it takes about an hour, unscrupulous persons could exploit the situation, could take advantage of it and then attack unsuspecting individuals at night and then rob them of their valuables. And as a result, he's appealing for authorities to pay attention to the situation here and have the road fixed for them. He also then referred us to some structures we can find here, items left, which we believe were originally meant to be used in fixing this road, but they've been abandoned, and I am very certain that it took the taxpayers' money to have some of these things provided. And I've had to pause the interview with our host